We're not showing them this extra so we can say like, aha, I told you it's not my fault, which a lot of us as dentists do, and that's just idiotic. So don't be an idiot. Yo, what up? It's a tip of the week, and today we're going to discuss how to manage a patient who has paresthesia on post-op. All right, guys. So what happens on paresthesia on post-op? The previous video, we talked about what to do before and during the surgery. This video specifically what to do when a patient has a paresthesia on returning to your office. All right. So if you're new to this channel, I'm Dr. Jared Williams. I'm a concierge dental surgeon in Houston, Texas. I focus on extractions and implants and IV sedation. And the reason why I created this channel is to have you smile through surgery. See, there were some challenges that I had in my family to where doctors didn't give the great care. And opposed to getting pissed off and screaming and yelling and complaining, I decided to create this channel. See, I've completed over 10,000 surgical cases, and I believe that the reason why my patients smile after surgery, hint, hint, is not because I'm a nice guy. It's because I'm following principles. And if you're a dentist or a recent grad who loves surgery but just wants to take it to that next level, this channel is just for you. All right, so in this video, the previous video, we talked about my patient. I was at the bank and she had a paresthesia and she's pulling me to the side. If you want to learn more about that, go to the previous video to learn about what that story is so that you can be caught up. So when the patient comes back to you, what you need to do is let them know, hey, follow up with them 24-hour post-op, tip number one. Tip number two, have them come back a week after. All right, make sure that follow-up is good 1 week after, especially if you know that the nerve is going to be involved with this actual tooth. Don't abandon these patients because that's when trouble comes. I have been in a situation to where my mentors told me the number one way to keep your patients happy and not to get sued. And if you follow these tips, you're going to continue to learn more. And the number one way to do that is to have great rapport and not to abandon your patients. Now, you could get sued regardless. Like, that's good. And there's no consent form or anything that's going to prevent you from getting sued. But to decrease your risk, building rapport and not abandoning your patient is vital. So that's tip number three. So 24-hour post-op, 1 week post-op, which don't abandon your patient. And also build great rapport. All right. In the event that your patient after 1 week has issues or 24 hours has issues, give them that Medrol dose pack. Get that on board. What the Medrol dose pack will do is it'll decrease the amount of inflammation that'll happen around that nerve. The reason why I'm doing that is because this is what the blood vessels do when they're disturbed. And blood vessels and nerves travel together. And when you have this pulsating motion, what happens is that nerve will get disturbed. And the nerve is generally housed in a canal, which is surrounded with bone. And if the blood vessels move, the nerve is not. And so all it's going to do is just be punched up against the side of that canal. And the nerve's just like, all right, screw this bullcrap, I'm going to sleep. And it literally just shut off until the blood vessels shut down. And so what ends up happening is just as you would put your elbow down and just rest and have the funny feeling with your fingers, that's the same exact way that happens when the nerve is disturbed. And so when you give that Medrol dose pack, it really settles it down. So I just give a 4 milligram taper, dispense one Medrol dose pack, use as directed, 0 refills. It does just fine. After a week, if they come back to you and they're still having issues, then what I want for you to do is determine, has it gotten better, worse, or stayed the same? By determining, are they getting better, worse, staying the same, what you're allowing yourself to do is say, okay, is the patient getting better, worse, staying the same? If they're getting better, then good. If they're staying the same, then if they're getting worse, then oh crap. So, yes, you could say oh crap, but just say it quietly. Don't bring that up. So once you see that, then you definitely want to look back at your x-rays and go over this with the patient. The reason why I want to say this is this, like I told you before, when we would trace these teeth that we're taking out, 1, 2, 3, and 4, we definitely, the next thing is you show them, hey, when we took out this tooth, it literally was nerve involved. And you're not telling them to be like, aha, I told you so. If you're an idiot, it's okay. Nothing wrong with being ignorant. And I said idiot, so don't be an idiot. There's nothing wrong with being ignorant, and ignorance is just not knowing something. What I want for you to do is if you're ignorant, continue watching this channel so that your ignorance will subside, it'll go away. And what ends up happening over time, your lack of knowledge will be diminished and your growth of knowledge will continue to grow larger and larger so that you can continue to smile after surgery and as well as your patients. So with that being stated, we're not showing them this x-ray so they could be like, so we could say like, aha, I told you it's not my fault, which a lot of us as dentists do, and that's just idiotic. So don't be an idiot, all right? So we're bringing this up just to remind them, hey, this is the challenge that we had with this tooth, and this is what we're facing. So what I'm gonna do is this, I'm gonna follow through with you through this entire process. And I would say we're at the week mark, the 1 week stage and all this, all right? So once we got that out the way, then we're gonna bring them back in about 3 weeks. So 3 weeks after the procedure. Once you bring them back after that 3-month mark, then you really wanna make sure, okay, are we getting some marked improvement? If we're not getting marked improvement, then what we need to do is send this patient out for referral. The longer you keep this unresolved, the worse off this scenario gets, the more hot water the patient jumps into. And if the patient's gonna have hot water on, the patient's gonna give you a nice big hug and pull you into that hot water bath along with them, because this is going to cause some challenges. And most patients love their doctors, but if they don't like you, you're gonna have to be in some hot water. So at that 3-week mark from the procedure, if they're not getting markedly better, then you want to go ahead and refer those individuals out. All right, so with that being stated, once you refer that patient out, then you're not out of the woods. Then you're going to do is this, I want you to contact the surgeon that you're sending them to. Now, not all surgeons are the same, so stop. I don't care what you specialize in, all this other bull crap. Yeah, bull crap. I respect the profession, but when your profession, even as a doctor, as a general dentist, as a specialist, whatever the case for you may be, you're still a human being. We're still human beings. And so that's what I mean by that. I respect all fields. My wife, she's a physician, and I respect her just like I respect dentistry. But when your profession gets you to the point where you don't care about individuals, you're falling in a bad place. And unfortunately, we as clinicians have that issue. And I want to nip that in the bud. As a matter of fact, if you're watching this channel, I want you to be humble enough to be like, yo, I don't care how much training I've done. I don't care how many cases I've done. I don't care how much CEs I've taken. If it's not about the patient first, then you're ruining the profession and you're not going to smile after surgery. And then there's going to be issues that are going to follow you around like a bad plague simply because you're not putting the patient first. And so you're going to contact the specialist. Wherever you are, what I like to do is this: if I don't know, I'll call the local dental school in my area or within the state, and I'll say, hey, do you know of any specialists that focus on nerve regeneration? Simple. You could Google it. Focus on any nerve regeneration. When they give you that referral, call the doctor. Let them know what happened. There's nothing wrong with having a issue with a case that did not go well and calling somebody up who's better than you, who's more experienced than you, and has the confidence to take care of this case and send the patient that way. Like, don't be fooled with this. Like, don't get cocky, don't get arrogant, because your arrogance is going to screw that patient over. And unfortunately, there's too much of that. And that's exactly why I created this channel. So before we go any further, guys, if you're liking what you're getting from this channel, hit the like button, smash subscribe, send it out. So when you look at this patient, ask the surgeon, like, hey, what can be done? What are you going to do so that you can learn for the next patient? Because all patients do is they come get treated, and then if you're doing your job halfway decent, they're going to refer individuals back to you. Like I said, the patient that was telling me, the teller who was telling me about her case, and once again, this is not her, but I wanted to give you this as an example. If the doctor who treated this patient for the last 15 years performed that extraction and would have waited, let's just say 2 months, and sent this individual to a specialist to figure out what they could do with this nerve, she probably wouldn't be having this paresthesia. And that's just unfortunate. And guys, I think I'm going to wrap this one up, because I think I'm going to make this a part 3, because there's more information that you need to know about dealing with paresthesias, because if you're going to do these cases, as you can see here, this nerve runs through third molar, 12-year molar, first molar, and premolar. And most people who would do a case like this, they would be like, oh, third molar is going to have nerve involvement, but not the first molar. Take it out. Oh, doc, the patient comes back. I have paresthesia. What's going on? And they're going to look twice and go, oh, crap, I didn't realize. And that's how you're going to get better. That's how you're going to smile after surgery. And that's how you're going to continue to improve. And that's how you're going to be recession proof. So there you have it, guys. I have one more video in this series. This one's running long, and I don't want to belabor it, but I wanted to let you know, hey guys, these are the tips that are going to revolutionize the practice. This is the tips that are going to allow you to go to that next level. If it's offering more services, if it's spending more time doing the things that you want, or if you're the individual that just wants to produce more in your practice, this is the channel for you. So there you have it, guys. This is part 2. We're gonna do a third video because as I'm speaking about this, there's a flood of information that's flowing through, and I want to not rush it, but I want to give you this information in bits and pieces so that you can smile after surgery. So there you have it, guys. I'm Dr. Jared Williams, and I want you to remember, what looks hard is often easy. Make it a great one.